Hi, I'm Dr. Brett Langston. I'm a prosthodontist and owner of Dental Implant and Aesthetic Specialists here in Brookhaven, Georgia, and I'm here to help you watch your mouth. And today we're going to talk about the 5 things that your dentist wishes you would stop doing. Number 1, stop chewing ice. And if you're from the South and you like to go to Chick-fil-A, they have the best little nugget ice. I get it. I put it in my mouth. I want to chew it. Sometimes I do and I catch myself. But I cannot tell you the damage that chewing ice does. It's just twofold damage. Number 1, the ice is really hard. And so you're putting a lot of force on those teeth, whether it's your natural teeth or whether it's crown and bridge work, it's really hard. And when you crunch and grind against something hard, it's a lot of wear and tear on your teeth. But number 2, ice is cold, and so it freezes the teeth. And so it makes the teeth more susceptible to fracture. And also the dental materials that we use are more susceptible to fracture. When you freeze them, they're not as pliable and they're not as kind of able to take those forces. So please, please, please don't chew ice. I know it's hard to do, but that's my number 1 recommendation that my patients stop doing. Number 2, do not tear things with your front teeth. I know it's convenient. I know sometimes it's hard to find nail clippers or hard to find scissors, but when you bite a package and you rip it off with your front teeth, you're putting so much force and duress on those teeth in a direction that they're not designed to handle. Front teeth are designed for vertical chewing. You want to incise and cut through things. When you put your teeth like this and you pull out, you're putting a lot of force out in a horizontal way. And you know, if you've got nice, healthy teeth, you're probably going to be fine for a while. But if you've got fillings or veneers or any kind of tooth starting to break down, all of a sudden, if that force is stronger than the strength of those teeth, you're going to do some damage. And whether that's just something as minimal as shearing off just a little bit of the tooth where I can get you in and kind of smooth it over and make it better, or a little filling. Unfortunately, I've had some stories where patients bit on a thing and pulled it out and they either broke off a crown, broke off a veneer, just did a lot more damage. And I know it's inconvenient, but please, if you can, get some scissors. Most of the things you can just open by yourself. Don't run through the risk of biting and pulling off. Thing number 3, not coming to see us every 6 months. Generally speaking, 6 months is a great time frame to come in and see us, even if you're like, oh, my teeth are healthy, I have perfect teeth, I never hurt. Just because nothing hurts doesn't mean something might not be wrong. That's the big concern. And 6 months is a good time frame for us to check up on your gum tissue health, for us to check up and make sure you're not accumulating plaque below the gum line where you can't see it. Cavities, a lot of times, especially the small cavities, you won't feel them at the beginning. And it's one of those things where if we catch them when they're small, a lot of times we can either put medicine on it to reverse the decay, or we can do a small filling. One of the other things we do at every checkup is an oral cancer screening. Oral cancer is a very, very debilitating disease. It's one of the things that moves very rapidly, and when it goes, it has a long impact. It reaches far. We have to see sometimes resection of the jaw, taking the tongue, parts of the tongue out. And it's one of those things that sometimes it could have been caught had you just come in and somebody took a look around and made sure everything was okay. So while it may seem like it's not necessary, it may seem like it's redundant coming in every 6 months, we want to see you. My hygienists love our patients. We love our patients. We love seeing everybody every 6 months, catching up on stories about where the grandkids are going to college, where the kids are going to college, this family moved here, upcoming weddings, family reunions. You know, it's not just a social visit, but that's a component of it too. We love growing with our family. Even if you're one of those people that thinks you don't need to come see us, please come see us every 6 months. If you, for some reason, we can't make that work, we can talk, we can figure out a customized plan to stretch it out. You may be one of those people that needs to see us every 4 months. We have a lot of patients that have either periodontal disease, have gum issue, have dexterity or home care issues, where 4 months is a better window for them, for us to keep everything in tip-top shape. Number 4 is disregarding the importance of your mouth in your everyday life. We live in a world where, you know, people will have $1 million house and have a $40,000 car, but they will scoff at a couple $1,000s to fix their mouth. And that doesn't make sense to me, because you use your mouth every single day, whether you're eating 3 meals a day, snacking, not to mention talking, chewing, functioning. You know, an ill-fitting denture or missing teeth or broken down teeth really does have an impact on your life. And unfortunately, it's one of those things where if your teeth are fine, you don't really think about them. But I can tell you on an everyday basis, patients that have broken down teeth or toothache or are missing teeth that impacts their quality of life, it's a big deal. So if you can be in that situation where you can restore your mouth and you can keep it healthy, it's definitely a worthwhile investment. Number 5, don't be scared of the dentist. I know everybody has heard a horror story or has a family member that has this tragic experience with dentistry. Unfortunately, that does happen, but I can promise you it won't happen here. We really do care about our patients. We want to make sure everyone's comfortable. We actually cater to dental phobes. We have a lot of patients for the first time that are really scared and nervous and anxious. And I think a lot of that is the anxiety of the unknown and just the assuming that this is going to be a horrible experience. I know they're going to laugh at me. I know they're going to, they're going to talk about me. They're going to put all this stuff in my mouth and cause me pain and discomfort. And that's not the way it is. We treat every person with respect. We love our patients. Come in and see us. We'll take our time. We make sure that every patient gets the time they need so they can feel heard and addressed, and we will make sure we come up with a customized plan for you. There really is no reason to be scared to come to see us. Check us out online. We've got tons of 5-star Google reviews from everyday people. We love seeing our patients. Every visit, we look forward to seeing you. So please, if you're not a patient, we'd love to meet you. We'd love to have you come join us and see us and show you that we are for real. We really are this nice. We really do love our patients. Give us a call, make an appointment. I'm Dr. Brett Langston. I'm a prosthodontist and owner at Dental Implant and Aesthetic Specialists here in Brookhaven, Georgia. And we're here to help you watch your mouth. Hi, I'm Dr. Brett Langston. I'm a prosthodontist. Wow, total brain freeze there. Okay.